Does what's in your mouth predict your health?
What's coming out of your mouth? I don't understand what's coming out of your mouth.
So today we're talking about how your dental health or your gum situation and your periodontal disease and your cavities and your plaque can affect the other aspects of your health.
I'm Dr. Paul Zalzal.
I'm Dr. Brad Weening. Welcome to Talking with Docs.
Now, when you think of, if I think about canceling surgeries or delaying surgeries,
Yes.
probably one of the most common causes is something to do with your mouth.
Like a tooth abscess.
Tooth abscess, I have a root canal, I got a cavity filling, I'm having a cleaning. Something to do with the mouth and the dentist, that seems to be, in my practice, one of the reasons where we run into, okay, wait, we got to schedule things properly for your total knee replacement or your total hip replacement. Just because the mouth is full of bacteria, and when you fiddle around in there, sometimes the bacteria get into your bloodstream, which we don't like when we put metal and plastic in your body.
Exactly right. And so when you have poor oral hygiene, this negatively affects that because the bacteria overgrow. And those bacteria deal with the sugars that are in your mouth. So high sugar diets contribute to this. And then that sugar gets converted, if it stays around, gets converted into a plaque. And did you know that as plaque sits on your teeth and it becomes calcified, it sits there longer, like 24 to 72 hours, that becomes tartar. Once it's tartar, you can no longer get it off with a toothbrush or floss. Did you know that?
I'd heard that before.
Yeah, it's very interesting.
Yeah, so if you're gonna get it out of there, you got 24 to 48 hours to do it.
That's right. So this is why good oral hygiene is good for your mouth. We talk about prevention of cavities, but what we didn't realize, or I didn't realize as much, is that it really affects every single system in our body. And they think that the mechanism is that chronic irritation of your gums leads to inflammation, leads to gingivitis and periodontitis. And this chronic state of inflammation reduces the amount of nitric oxide that's in your body, and this contributes to all sorts of medical problems in our body.
Gingivitis. Fun thing to say, not a fun thing to have.
Okay.
And if you think about it, the mouth is the top of your GI tract. It is a system. It's part of one of the most important systems in your body. Your GI tract starts at the mouth.
Right.
So that's why you got to take care of it.
So we're just going to go through some of the things that it causes, and we're going to link a couple articles, the Journals of Periodontology, which I don't get anymore. I let my subscription lapse, and I just never renewed it.
I'll send you some of my back copies. Okay. You can get caught up on that.
But they've done good studies on people with bad oral hygiene, how it negatively affects their health, how interventions have changed people's oral hygiene, how it's improved their health, and the predictors of some of these things. So let's start at the beginning. Your heart. Heart disease, #1 killer. And good evidence to show that poor oral hygiene, so gingivitis and periodontitis, increases your risk of heart attack, stroke, and even atrial fibrillation.
Who knew?
Who knew?
Right from the get-go.
Yes.
Your teeth are linked to your heart.
Yes. Number 2 is the sugars. No surprise if you have a bunch of sugar sitting in your mouth, those bacteria are dealing with that. This can cause inflammation and can lead to difficulties with poor sugar control. So people that are diabetic, it can increase your chance of having type 2 diabetes, and making that diabetes harder to control. So,
well, that's the latest trends, right? We know in health is inflammation bad for you across many systems of the body, and high blood sugar, increased levels of insulin resistance. Those are the other things that can affect many systems in your body.
Number 3 is your respiratory system. So you can get so much bacteria in your mouth that you actually can inhale some of them into your lungs, and this can increase the chance of you getting respiratory problems like pneumonia and other chronic lung diseases. So clean out your mouth.
The mouth happens to be part of the respiratory system too, eh?
Yes.
Not a lot of things that sort of we borrow in two systems like that.
Honestly, it's critical. So number 4 is pregnancy. There's good evidence to show that people with poor oral hygiene and oral health have more preterm births and lower birth weights. So this can even help your unborn baby by keeping your mouth happier.
Who doesn't even have teeth of their own yet?
Actually, well, that's a nice segue because it relates to Alzheimer's and dementia. And there are studies that have looked at the number of teeth that people have and the status of their mouth, and it does predict or increase the risk of you getting both Alzheimer's and dementia. They think it may be related to one of the specific bacteria that lives inside of your mouth, but it's directly correlated.
We used to talk about that in med school, the teeth to T ratio,
the tooth to
tattoo ratio.
Yes.
If you have a low tooth to tattoo ratio, your health is probably not so good.
Right. So now you know, hey, well, maybe I'm not keeping up on my oral health. What can I do, or what is the ideal health protocol for my mouth that can increase my chances of affecting my other health?
It's not that tough.
Okay, let's start at the
beginning. You
beginning.
gotta brush your teeth.
Okay, so let's talk about brushing teeth. So brushing your teeth has been studied for a long period of time. They say the ideal amount of time to brush your teeth is about 2 minutes. So brushing
per tooth?
No. per tooth. 2 minutes. But what they've shown is that if you brush your teeth for 2 minutes versus 45 seconds, you actually remove 26% more plaque.
There you go. So brush your teeth. What about electric toothbrush?
Well, I was going to go there next.
I love the electric toothbrush.
Right. So they say that electric toothbrushes are superior for a bunch of reasons. A, because technique of manual toothbrushes, most people don't do it properly. Number two is that it helps control the hardness or how hard you're pressing. So it can have some pressure sensors to reduce the amount of pressure so it doesn't do damage. And three, because of the oscillating action, you get in some of the deeper cracks.
Okay.
Okay, so I'd say twice a day. 3 times a day is not necessarily full benefit. So 2 times a day is the optimum number. 2 minutes, electric if you can afford it, but they are expensive. If you do have a manual toothbrush, you have to just be more careful of your technique and maybe set a timer.
Floss.
Okay.
Flossing to get between the teeth.
Flossing is critical. Definitely increases the amount of plaque that you remove as well as health of your gums. You got to get into those difficult spaces. So you should do it once a day is the number one. And ideally they say at the end of the day. So obviously you've filled your cracks of your teeth with food during the day, do it before bed, and you should also floss before you brush.
Right.
Makes sense.
My dentist recommends a water pick too, in lieu of flossing.
So I looked at this and they said that there are some benefits to the water pick. Ideally, actually, you would do both.
Oh.
Because they do different things. They say that the water pick can get deeper
Right.
and is really good for people that have either braces
Yes.
or a retainer or other kind of things to drive some of that food out.
Okay. So we've done the brushing, the flossing, plus or minus the water pick.
Yep.
The next one is some kind of mouthwash.
What do you think about mouthwash?
You know what? I love mouthwash.
Because you don't want bad breath, right?
Yeah, that, and I thought during the pandemic too that mouthwash twice a day with like an alcohol-based mouthwash was a good idea without a ton of evidence to support it,
Right.
but just a deep gargle to minimize the chance of getting an infection.
Right.
That was my anecdotal thinking during that time, but I suspect you're going to tell me something bad about that.
So there's reasonable studies to show that the alcohol actually kills some of the bacteria that's in your mouth. So it upsets your mouth microbiome and actually can lead to a dry mouth, which can lead to cracks and problems in your. So most people would recommend against alcohol-based or chlorhexidine-based mouthwashes and trade it off for like either a saltwater mouthwash or even a green tea or a more natural mouthwash.
Okay.
So that's kind of gets a honorable mention, but certainly not critical for good oral
Yeah,
health.
so whenever you're drinking your green tea, you keep a spittoon nearby, have a sip, spit it out.
Oh, green tea is good.
No, I do, I like green tea.
Yeah, green tea. But this is another thing that now that my wife will be like, I've been telling you to floss more all that, and I'm always bad at flossing.
Okay,
But now I want to protect my heart,
right.
and I want to protect my lungs,
Yes.
and I want to not get Alzheimer's and dementia. Like I thought
right.
that one alone was like, wow, that's
Yeah.
the reason right there.
Brush.
Right.
Okay, so then the next thing's probably one of the most important things that you can do is just stay hydrated.
Yes.
Keeping your mouth hydrated, because when your mouth goes dry, that will throw your bacterial cultures, your bacterial biome in there is going to go out of whack.
Yep.
If your mouth, it needs a moist environment. And then the next one I would say is just visiting your dental hygienist or dentist on a regular basis if you can, if you live in an area where you have access to that.
And they have actually done specific studies where these are the interventions because tartar cannot come off with brushing. You need to actually have cleaning. And they said once is probably enough, but twice if you have access or can afford it. But definitely these interventions have improved people's general health. And again, we'll provide a couple articles so that you can look at it yourself, but definitely measurable benefits going to the dentist. So it's not just a cash grab.
No, unless you're an alligator, open your mouth and a bird can do it, you really need to go to the dentist. That's what they do.
Now you know. If you like this video, please like it, subscribe to our channel, leave a comment about your oral health strategy.
And remember, you are in charge of your own mouth.
We'll see you next time.